Hello everyone, welcome back to the second part of the video. In the previous video, we have discussed about the introduction of the platelets, its physiological function, structure and other related morphological changes. And today, in this part, we will be discussing about the properties and the abnormal increase, both the physiological and pathological increase and decrease in detail. So without any delay, let's dig into the topic. Starting with the properties, we know that platelets have three important properties and they can be memorized by the trick 3 A's. What are they? At number 1, adhesiveness, second, aggregation, and third, agglutination. So, starting with this individual three. Firstly, what does adhesiveness actually mean? So, adhesiveness means, we all know the term adhesion means sticking something with another thing. So, adhesiveness is the property of sticking to a rough surface. That is, during injury of blood vessel, endothelium is damaged and the subendothelial collagen is exposed. And when it is exposed, what is happening is that while coming in contact with this collagen, the platelets are activated and adhere to collagen. So let's understand it with the help of a rough diagram. If we consider it to be a blood vessels and the RBCs, WBCs, platelets, the entire composition of the blood is flowing through it. So if there is any kind of rupture or injury at this site, what is happening is that the endothelium the endothelium wall is actually damaged, and as a result of which the subendothelial collagen is exposed. And when it is exposed, the blood which is traveling, when it comes in contact with it, especially which part, the platelet part, it adheres to it. So this is what we mean by adhesiveness. And this adhesiveness is also by various factors. Next, the aggregation. So aggregation means, by the simple term itself, we know aggregation means aggregate, or when a group of things comes together or forms a cluster like thing. So aggregation is the grouping of platelets. Adhesion is followed by activation of more number of platelets by substances released from dense granules of platelets. So in simple term, it is saying that it is the grouping of the platelets. The platelets which was first being adhesed to the subendothelial collagen is now getting aggregated or clumped together. And last but not the least, the agglutination. So what does agglutination means? It is the clumping together of the platelets. Aggregated platelets are agglutinated by the actions of some platelet agglutinates and the platelet activating factor. Next, the factors, that is the blood clotting, blood retraction, prevention of blood loss, repair of damaged blood vessels, and defense mechanism. So these are the main or the most important properties of the platelets. We all know that whenever there is a cut, there is an involvement of the platelets, and hence the blood clotting, it will clot the blood and prevent further bleeding. Blood retraction, prevention of blood loss, and also repair of damaged blood cell, which is very much important. And last but not the least, the defense mechanism. So these five being the most important properties of the platelets. Next, the normal count and the fate. The average lifespan of platelet is 10 days. This is very important. And also it varies between 8 and 11 days. Definitely the 10 days is of the median value. Next, the platelets are destroyed by tissue macrophage system in spleen. So basically, they are getting destroyed in the spleen, just like that of the RBCs. So splenomegaly. What does splenomegaly means? It is an enlargement of the spleen. Decreases platelet count, obviously. So if the spleen is getting increased in size, the number of platelets will be getting decreased more, and as a result, the total count of platelets will decrease. And splenectomy, that is a removal of spleen, increases the platelet count. Now the normal count and the fate. Firstly, we will be studying various terms here, starting with the thrombocytopenia. It is very important from both the physiological and pathological point of view. That is, decreased. What does thrombocytopenia means? It means the decrease in platelet count. It is known by the thrombocytopenia. In simple term, it is meaning that the platelet count is getting decreased. It leads to thrombocytopenic purpura. That means the whenever you will touch the injured or the affected side, it will start bleeding. Thrombocytopenia occurs in the following conditions. They are acute infections, acute leukemia, aplastic pernicious anemia, this is very important, chickenpox, smallpox, splenomegaly, scarlet fever, typhoid, tuberculosis, purpura, and last but not the least, the Gaucher's diseases. In all these cases, what is happening is that there is overall decrease in the platelet count, and this is known as the thrombocytopenia. Next, the thrombocytosis. It is just the reverse of the thrombocytopenia, except here what is happening in thrombocytosis is that there is increase in the platelet count. So thrombocytosis occurs in the following condition, that is the allergic condition, asphyxia, hemorrhage, bone fractures, surgical operation, splenectomy, rheumatic fever. This is very important. Trauma. So these are the conditions where there is increase in the platelet count, which is often referred as thrombocytosis. And lastly, the thrombocythemia. That is, thrombocythemia is the condition with persistent and abnormal increase in platelet count. So there is a slight difference between the thrombocythemia and the thrombocytosis. That is, in thrombocytosis there is increase in platelet count that it can be of once in a lifetime, or due to some particular factor there is sudden spike in the number of the platelet count. However, in thrombocythemia there is persistently an abnormal increase in the platelet count. So thrombocythemia occurs in the following conditions: carcinoma, the chronic leukemia, and Hodgkin disease. All of these being the major factors of the thrombocythemia. So with this, we come to the end of today's topic, and we have successfully covered the platelets in details. If you have any doubt regarding this video, do let me know down in the comment section below. Thank you.